Um, yeah, definitely. I would like to share about a case that we have recently operated an international patient. A patient is a child of 8 months, brought down by parents from Kenya. Parents observed that the child had a large swelling in the lower back immediately after the delivery, and there was a partial skin loss. And the doctors there, they have advised for surgery, but they didn't get the surgery done there, and they wanted to visit India and get the treatment done here. So the child landed in Hyderabad, and I thoroughly clinically assessed. I got an imaging done, and we came to a diagnosis that this condition is called Spina Bifida with myelomeningocele in the lumbar area. That is, there's a swelling which is seen in the lower back, and the swelling contains the fluid of the spine as well as all the spinal nerves, including the spinal cord. It was totally into that swelling. This again is very deleterious to the child, because the child would be prone for weakness in both legs, as well as the power to hold urine and motion would be lost. We are talking in the scenario the child is 8 months old, and the child would still not have developed the control for bladder as well as for the motion. So all these conditions should be surgically treated, and they always are associated with other spinal conditions as well as other brain conditions. So the child was thoroughly screened for that, and we have concluded that this was the only problem, and we have advised for surgery. So surgery is a complex situation wherein we have to, this is called a tethered cord with myelomeningocele in the lumbar area. So we have to untether, that is, all the nerves which are struck to that swelling have to be released, so that the nerves they go into their regular position, and the swelling has to be removed, and we have to suture it back. This complex surgery was performed by me as a neurosurgeon, and it was again contemplated with a plastic surgeon who helped in wound closure, because the lump was quite significant, and after the removal of lump, there would have been a definitive chance of a skin loss. So with the help of the plastic surgeon, we were able to close that wound. In the advent of modern gadgets in neurosurgery, the surgery was very precise, was very safe, and we operate with the help of a neuromicroscope, which is a high-end microscope which gives us a very crystal clear view of what we are operating. At the same time, the surgery was done under a neuromonitoring. Neuromonitoring is nothing but it gives us a real information that which nerve is functional and which nerve is not functional when the child is under general anesthesia when we are operating. So real information, real-time information is given to us, so that we don't cause additional damage to the child. At the same time, we make sure that all the nerves are well preserved, and we were able to remove the swelling in the back and create some wound to the patient. Post-surgery, the child recovered very well. The child was here for a couple of months. Till the wound was totally healed. There was no additional deficit that we could clinically pick up after the surgery. The child was very active. The lower limb movements were very brisk and healthy. But child does require observation over a period of time, because we need to assess whether the child really has the urge to control the urine and motion, which is usually seen in the after a few years of life. So we did advise the parents to bring back the child probably initially after 6 months, and probably a year or two after that, so that we can have a real assessment how the child did. Otherwise, the surgery has been thoroughly successful, and we are happy in that we could save the power in the legs, as well as probably the bladder and motion control. So I just wanted to share one such patient which we have treated from Kenya.